body. Hey, drug abuse the body, oh. The body, oh. The body, oh.
This message is brought to you by the National Drug Law Enforcement Agency, NDLEA.
Even though, even though, even though, even though it not to me, even to my body, oh, even though it not by me, he don't buy somebody, oh, even though you never, even though you want to, I really no bother, they go on do you, even though you didn't know, now you know, drug abuse is bad, oh, even though it all do me, even do my body, even though you don't buy me, you don't buy somebody, even though you never, even though you want to, I'm again no bother, big old wound do you, even though you didn't know, now you know, drug abuse is bad, oh. Don't do them lie, don't do them no lie, I will do my part, I will sing them louder, even though, you know, be a drug addict, do your part to make I next for no carry them, even though you never, even though you want to, I barely no bother, they go on do you, even though you didn't know, now you know, drug abuse is bad, oh, even though it don't do me, even do my body, oh, even though it don't buy me, it don't buy somebody, oh, even though you never, even though you want to, I'm again no bother, big old wound do you, even though you didn't know, now you know, drug abuse is bad, oh. Even your friend says it's cool, don't fall for it, don't fall for it, even the country hard, oh, don't fall for it, drug abuse is bad, oh, even though you never, even though you want to, I barely no bother, they go on do you, even though you didn't know, now you know, drug abuse is bad, oh, even though it don't do me, even do my body, oh, even though it don't buy me, it don't buy somebody, oh, even though you never, even though you want to, I'm again no bother, big old wound do you, even though you didn't know, now you know, drug abuse is bad, oh, even though you didn't know, now you know,
In southwest of Nigeria, this is NDLA's Open Forum on X Space on this day, Friday, 1st of September 2023. We are live from the national headquarters of the National Drug Law Enforcement Agency, NDLEA, here in Abuja, Nigeria's Federal Capital Territory. For those joining us from other parts of the world, Europe, America, Asia, Middle East, and even the rest of Africa, we welcome you. We appreciate your decision and your preparedness to be part of this conversation today. Like I said, this is NDLA's Open Forum on X Space. This is a platform where we share information about drug abuse and ignorance danger. It's also a channel where we update you about all the activities of the agency, especially what we're doing to up the menace of substance abuse and illicit drug trafficking, as well as getting your feedback so that we can continue to do the best of what we're doing. This conversation, I'd like to tell us, is recorded and is streamed live on other social media handles, especially at NDLA01 on Facebook and at NDLA_Nigeria on YouTube and I think Instagram also. You can always go back to the recorded version of this on any of these handles and listen to it, where you can also share with others, especially those who you believe need the knowledge that will be shared on this platform, those who would also gain one thing or the other from the conversation, because this is not just about the NDLA, it's about all of us. We have, that's why we do bring in people, experts from outside of the agency to share knowledge, to share facts, to share information about this drug menace, even from outside of the agency. We appreciate you being part of us today. Before we invite our guests, let me also tell you that today we would have also seen on our e-flyers that the publicity we've done for this program. Today we will be discussing drug use disorder, how to overcome recovery challenges. Quite a lot of people are facing challenges in the course of seeking treatment, in the course of seeking help, especially those that are already in the stage of addiction, that is suffering from drug use disorder, the short form of DUD. And today we have no other person than someone who has been part of whose educational and work career has been all about this particular field, especially in the area of we'll be introducing him shortly, but before we introduce him, I would like to we would like to remind you about some of the activities of the agency in the course of the past week. And that will come your way in our news highlight segment, which will be taken by our regular, that is Blessing Tapa. Blessing, over to you. Let's get some updates from you, and thereafter we'll proceed with the rest of the program. Thank you once again. Welcome to each and every one of us. I remain yours sincerely, your host on this particular show. I am Femi from Akemi. Thank you. Over to you, Blessing.
Thank you, sir. Good day to everyone, and thank you for joining us on this week's X Space. My name is Blessing Tarfa, and here are the NDLEA news highlights for the week. South Africans arrested with methamphetamine consignment at Abuja Airport, as NDLEA intercepts 1,343.8 kilograms of skunk, ketamine going to UK, Indonesia, others. Seizes 514,420 pills of opioids in Gombe, Adamawa, Ogun State. Attempts by a 29-year-old South African, Erasmus John Kerr, to export 2.6 kilograms of methamphetamine concealed in his luggage to the Middle East through the Nnamdi Azikiwe International Airport (NAIA) Abuja on Wednesday, 23rd August 2023, was spotted by operatives of National Drug Law Enforcement Agency (NDLEA), who arrested him and recovered illicit drugs. The suspect was intercepted by NDLEA operatives during the outward clearance of passengers on Ethiopian Airlines flight ET-404 from Abuja to the Middle East via Addis Ababa, Ethiopia. The thorough search of his luggage led to the discovery of the whitish powdery illicit substance packed in different parts of the bag. Preliminary investigation reveals that the suspect arrived Lagos through Abidjan, Cote d'Ivoire on Saturday, 19th August, came to Abuja on Tuesday, 22nd August, and took possession of the brown bag containing the drug consignment on Wednesday, 23rd August, before heading to the Abuja airport for his flight out of Nigeria. Meanwhile, NDLEA officers in Gombe State on patrol along the Sarazu Road on Monday, 21st August, recovered an abandoned Volkswagen Taros vehicle marked GME 76XD containing a total of 373,420 pills of opioids, including tramadol and diazepam. In the same vein, operatives in Ogun State on Wednesday, 23rd August, made up the hope of a drug dealer UOG in Ibafo area of the state, where 81,000 tablets of Tramadol, 225 milligrams, weighing 32.4 kilograms were recovered. In Adamawa State, NDLEA operatives on Tuesday, 22nd August, recovered 60,000 pills of Tramadol from the suspect, Ibrahim Abba, 25, who was traveling in a commercial Toyota-started car from Kala'a village to Mubi. Equally, in Abuja, the Federal Capital Territory, operatives intercepted 2 consignments of skunk with a gross weight of 1,242.1 kilograms. The first consignment of 665.1 kilograms was seized from a truck around Area 3 on Sunday, 20th August, while the second one, weighing 577 kilograms, was recovered during a stop and search operation around Lokoja Abaja Expressway same day. The consignment was concealed in Jumia goods delivery packs inside a container Mercedes truck, whose driver Yusuf Yakubu Asokome and his assistant Tunde Ogundare were arrested. In Kwara State, operatives on patrol along Jeba Mina Road on Tuesday, 22nd August, intercepted a commercial truck conveying goods from Lagos to Katsina with 37.5 kilograms of cannabis sativa hidden among other items. The driver, Abdulaziz Usman, and his assistant, Khalid Musa, were arrested for further investigation. Similarly, in Yobe State, NDLEA operatives on Wednesday, 23rd August, intercepted an ash-colored Sharon Galaxy vehicle marked AKG 484XA along Fortiston Bombay Road, coming from the Isa Kurumi local government area of Taraba State. 3 suspects in the vehicle, Yahoo Nafiza 30, Aya Mohammed 29, and Tanya Musa Yusuf 20, were arrested with 133 blocks of cannabis sativa weighing 62 kilograms. Operatives in Edo on Thursday, 24th August, stormed the Useba forest in Owan West local government area of the state, where they arrested Esa Zobo Okieze, 33, 54.3 kilograms cannabis recovered from a pot, while a total of 2.995696 hectares of cannabis farms were destroyed. Efforts by transnational drug cartels to move the consignment of 117 grams of ketamine legally concealed in a pair of leather mule slippers being shipped to Indonesia and 2.14 kilograms of skunk clinically hidden in the walls of a local wooden drum were equally frustrated by NDLEA operatives of the Directorate of Operations and General Investigation (DOGI) attached to courier firms in Lagos. The Chairman Chief Executive Officer of NDLEA, Brigadier General Mohammed Bumar, were retired, while commending the efforts of the officers and men of the NAIA, Gombe, Ogun, Adamawa, FCT, Kwara, Yobe, Edo Command, as well as those of DOGI for a job well done in the past week. He charged them and their colleagues across the country to intensify their drug supply reduction operations and equally balance that with drug demand reduction activities. That's it on arrests and seizures. Now, here are the other activities across the country for the week. The Osun State Command of NDLEA on Monday, 21st August 2023, facilitated a WADA sensitization lecture for members of the Nigerian Association of Patent and Proprietary Medicine Dealers at their zonal meeting in Edo. The training highlighted the role of the association in curbing the supply and distribution of illicit substances while strengthening their efforts in regulating patent stores. Still on Monday, 21st of August, the Zamfara State Command conducted a WADA advocacy visit to the EPA Church Reserve. The agency informed the congregation in the ongoing drug war and the need for religious advocates to include the dangers of drug use in their sermons. On Wednesday, 23rd August 2023, the Ogun State Command of the agency conducted a WADA advocacy lecture for pregnant women undergoing antenatal care at Olikoye Kuti Memorial Hospital, Ashero, Abeokuta. The agency emphasized the potential dangers of using illicit drugs to the growth and development of their fetus, and the need to abstain from illicit drugs even after childbirth. While the Kwara State Command also paid a WADA advocacy visit to Governor Abdurrahman Abdurazak, on the same day, the Jigawa State Command paid a similar visit to His Royal Highness, the Emir of Dutse, Alhaji Amir Nuhu Sanusi. The agency encourages leaders to use their position of influence to promote the war against drug abuse in their constituencies. The Ondo State Command also on Wednesday, 23rd August, facilitated a WADA sensitization lecture for traders at Sabo Market, Ondo Town. This is in keeping with the NDLEA's mandate to take drug education to the grassroots and ensuring that the society is an active participant in the fight against drug abuse. On Thursday, 24th August, the Kano State Command of NDLEA presented a wider sensitization lecture at Said Rubin Sadiq Secondary School, Sabongari Wudil, Wudil Local Government Area. The agency is committed to educating young adults about substance abuse so that drug use will not have a lasting impact on their future. To wrap up the wider activities for the week, the Abia State Command conducted a sensitization lecture for students and youth of the Anglican Communion, Aba Diocese, during their 2023 annual conference on Friday, August 25, 2023. The agency urged the youth to remain faithful to their religious beliefs and repress the impulse to experiment with drugs. That's the update for this week. My name is Blessing, and I hand you over to our host, Mr. Femi Babafemi.
People for jail, war against drug abuse.
Very well, thank you, Dave. Blessing, welcome back from the news highlights segment. Now let's remind ourselves about some of the rules guiding our process of engagement on this platform. Please note that soon after the presentation by our guest today, when we approve you to be on the speakers corner, please ensure that you remain muted until after our guest presentation. I will start inviting individuals to unmute themselves to either ask questions, make their contributions, and please, when we do this, let's do this in few seconds. And also, please, let's stick to the subject matter of today's conversation. That is the topic that our guest will be speaking to today. Please, let's restrict ourselves or other related matters that have to do with the work of the agency, whether in drug supply or drug. Let's please remain guided so that we can all enjoy and benefit from the conversation. Once again, I'd like to thank you for your usual cooperation in this regard. Like we always have it, would try as much as possible to make this as interactive as possible. Would also respond to your questions, take contributions, like I said, on today's subject of discussion. Please, let's stay calm and let's enjoy the conversation without interruption and following the rules of our conversation. This is all part of our commitment to engage with all our stakeholders so that we can do the best to tackle the problem of substance abuse and illicit drug trafficking in our society, especially our country, Nigeria. Now, before I invite our guests, let's quickly remind us again about the NDLEA Call Center. That is a center that was set up last year to provide help for those who are struggling with substance abuse and don't know what to do or how to get help, or those that are even scared of being stigmatized or being judged if they walk into a rehab center. At the center, at the NDLEA Call Center, is experts there. We have quite a number of experts there, ranging from clinical psychologists, counselors, psychotherapists, psychiatric doctors, mental health experts in all shades. They are all there working 24/7, and all you need to do, any part of the country, wherever you may be, just dial the toll-free helpline 080, another 0, then 10203040. Again, the number to dial is a toll-free helpline and is a 12-digit number. It's not like our regular GSM 11-digit number. This is a 12-digit number. The number is 0800 10203040. Please ensure that for anybody who is having issue, either the person or a family member or a friend, you can call this number to seek help for the individual, provided the person affected is willing to get help and to be attended to. Our experts at the call center will definitely attend to you any time of the day. And if you have issues, if you have issues with speaking with them in English, we also, the center is also language friendly. They can also engage with you either in English, Pidgin, all the three major Nigerian languages, that is Hausa, Yoruba, and Igbo. please, this is all part of our determination to ensure that nobody is left out or nobody is denied access to help, to needed help. Please, let's ensure that we take this into consideration and share with others who may not be privileged to be aware of this. Please, let's also share the information with them. Our experts there will attend to them. In some cases, through teletherapy, some when they review their cases and if it's such that they need to check such persons into a rehab center, they would direct you and follow up with you, assist you to ensure that they connect you with the nearest rehab center to you wherever you are. That's all about call center. Now, let's formally introduce our guest today, and is no other person than Dr. Abdullahi Abdul Wahab Yakubu. Dr. Abdullahi Abdul Wahab Yakubu actually studied Bachelor of Medicine, Bachelor of Surgery at the Ahmadu Bello University. And beyond that, he's had quite a number of robust degrees and certificates in a lot of other fields. And in the area of medicine, he equally has a master's in public health, also at the Ahmadu Bello University in Zaria. He also has a postgraduate diploma in global mental health, that is at Alison Educational Institute, that's Ireland. Again, he has advanced certificate psychological first aid at the National Child Traumatic Stress Network, USA. He also has another certificate in leadership and management in global health from the University of Washington, USA. He is a fellow of psychiatry at National Postgraduate Medical College of Nigeria. He joined the Department of Psychiatry, Ahmadu Bello University, as a lecturer, and Ahmadu Bello University Teaching Hospital as a junior psychiatry resident in some years ago. By the grace of God, apart from his full-time work, he's also set up a non-governmental organization where he also supports and assists people. And so he's also the executive chairman of Excel Mental Health Foundation, and he is joining us live on the handle of Excel Mental Health Foundation, and that is no other person than Dr. Abdullahi Abdul Wahab Yakubu. Dr. Abdullahi, please unmute yourself and let's listen to you for the next 30-40 minutes, and thereafter we'll engage in a regular conversation. Thank you very much.
All right, thank you very much, Mr. Femi Babafemi. Thank you to our listeners. Thank you for having me today at the speaker's corner, not the listener's corner. I will start by taking us through the concept of what drug addiction is. Drug addiction is a complex illness characterized by compulsive and at times uncontrollable drug craving, seeking and use that persists even in the face of extremely negative consequences. Addiction, I want us to know, is a brain disease that is chronic and relapsing in nature. When people first try drugs, it is usually a voluntary decision, but after using the drug for a while, it is no longer voluntary. The reason being that prolonged drug use changes the brain in fundamental and long-lasting ways. That is to say, continuous drug use can completely rewire the brain. And I also want us to understand that drug addiction is like other diseases in the sense that it is preventable, it is treatable, and if it is left untreated, it can last a lifetime. You know, there are many ways to describe an addiction, but no single definition captures each individual experience with this disease. The reality is that addiction recovery is a unique journey for each person. However, in spite of all the differences, there are certain challenges that most people in recovery can relate to. You know, understanding these challenges can better equip us to help the people in our lives who are trying to overcome the problem of drug addiction. So let us look at some of the commonest challenges people face during the recovery process or when they are trying to undergo the recovery process. The first challenge I would like to talk about is relapse. You know, relapse in the context of substance use refers to a return to substance use after a period of non-use or after a period of abstinence. You know, Recovery in drug use is basically a behavioral change. And if we look at the change cycle described by Prochaska and De Clemente, where we have certain phases of change where individuals go through when they are trying to change from one behavior to the other, starting from a place where we call pre-contemplation stage. In this stage, the individual with this drug use don't even see that anything is wrong with his substance use. So with some support, with some counseling and what we call motivational interview, you can move this person from the stage of pre-contemplation to contemplation stage, where the person begins to think, oh, come, is it possible that this drug I'm using is actually causing me some problems? The person begins to contemplate. And then from that phase, the person can move to a phase where we call decision phase, where the person actually decide that, look, I think this is a problem and I need to change. From the decision phase, the person moves to the action phase, where the person actually take concrete steps to have a behavioral change. That is to change from taking these drugs to a person who doesn't take the drugs. So from the action phase, we move to where we call maintenance phase, where the person actually maintain abstinence from these drugs. And then this cycle can go back to the pre-contemplation stage in case the person relapses. Now, what I want us to understand is what during this change cycle, abstinence, that is a lapse. But a situation where somebody has gone back to the pre-rehabilitation stage of substance use, we say the person has abused. So lapses and relapses are very common and normal part of the rehabilitation process. Overcoming addiction is not something that happens overnight. It is an extremely difficult and often painful process that takes time and plenty of hard work. Throughout the journey of recovery, with its many obstacles, it can be tempting for an individual to fall back to their old habits. This is because their addiction has taught them to seek refuge in drugs and alcohol to cope with difficulties. And recovery is one of the biggest challenges they will ever have to face in their life. So a patient is often at the highest risk of relapse while undergoing recovery. You know, this is especially true during the detoxification stage. That is when their body is attempting to rid the system of a substance they have depended on for so long. Because the body has become so used to this substance, once you are getting rid of it, the body can react in a way that can be very difficult for the person to tolerate. We call that withdrawal symptoms. So the symptoms of withdrawal, which include sleeplessness, mood swings, irritability, digestive problems, body aches, among others, can be very challenging to manage without the necessary medical and or psychological support. So for this reason, going through the detox process under a professional care is vital. Not only does self-detox put someone, we have seen situations where some drug users can even convulse when they are going through this withdrawal stage, convulse, and even fatalities have been reported. So it is really very good to do this detoxification with a professional or in a professional setting. So trained addiction experts know how to help patients manage their symptoms in a safe environment while offering medication or counseling as needed. The second challenge to recovery I would like to talk about is mental health issues. You know, after having developed such a strong dependency on a substance, learning to live without it can truly test a person's emotional and physical limits. With such a profound level of stress placed on them, individuals who suffer from mental health issues may find the recovery exacerbate their symptoms. This can make an already difficult process even more trying. You know, mental health conditions that occur alongside substance use disorders are known as co-occurring disorders or comorbidities. So people who suffer from mental illnesses are generally at a higher risk of addiction. And conversely, people with addiction are at a much higher risk of developing mental illnesses. So there is a bidirectional relationship between substance use and mental illnesses. So comorbidities can pose a huge risk to an individual's chances of success during recovery. So when mental health symptoms begin to worsen, the urge to relapse can become unbearable. You know, it is often it is important that comorbid mental illnesses are properly and adequately managed by trained professionals alongside the rehabilitation process to make the recovery process less challenging. The next challenge I would like to talk about is social stigma. You know, addiction is often stigmatized and viewed as a moral problem, especially in our society, with those in recovery being blamed for their problems. This stigma creates shame, guilt, and fear, which can prevent many people from seeking treatment. Stigma can also impede access to care and reduce the quality of care individuals receive. Stigma on the part of healthcare providers can lead to substandard care or even the rejection of individuals seeking treatment. You know, it's not just the general public that stigmatize people that use drugs. Even some healthcare professionals can be guilty of that. And some people can outrightly reject to manage people with these problems. So many individuals who struggle with substance abuse may feel ashamed, embarrassed by the way others treat them or behave around them. You know, this can cause them to lose friends or feel like an outcast within their own family. So as they attempt to recover from substance use disorder, many individuals falsely believe that they are a failure to have for having to receive treatment for addiction. You know, this can hamper their progress towards the end goal of sobriety or abstinence. You know, if someone close to you is a victim of this perceived stigma, it is crucial to remind them that seeking help is a sign of incredible strength, that the choice they have made to begin the recovery process is a huge step forward towards overcoming the addiction. So rather than focusing solely on how substance abuse has negatively impacted their life, it is important for individuals in recovery to look forward to the addiction-free life they can achieve. You know, throughout recovery, it is important to keep these points in mind as they can help remind the person of what is important in their recovery journey so they can rise above this social stigma. The next challenge I would like to talk about is financial struggles. You know, the challenges of addiction recovery are not only emotional in nature. As a person continues to struggle with substance abuse, they might find themselves facing significant financial troubles. You know, in the early stages of using alcohol or drugs, the price of these substances may seem negligible. However, it is easy to see how the costs add up very quickly over the course of addiction. You know, it does not take a long for somebody or someone with substance use disorder to realize that they have spent a good portion of their savings on drugs or alcohol. The financial cost of addiction does not only involve the substance themselves. Substance use disorder can consume a person's life until their addiction becomes the center of their world. They no longer give any other thing priority apart from the addiction. So as a result, many of their most pressing responsibilities like work, family, school, etc. are completely neglected. For instance, it is not uncommon for individuals with addiction to stop showing up to work or fail to complete their assignments on time. As this behavior persists, they might lose their jobs and suddenly find themselves with no source of income to rely on. So other financial obligations such as paying rent can also go unfulfilled as a result of addiction. So this creates a vicious cycle in which the individual continue to prioritize their dependency on this substance instead of other important areas of their life. So this financial turmoil may make it difficult for those who are struggling with addiction to get the help they need to recover. Actually, rehabilitation process can be costly. And so with all this, with this kind of financial challenges, individuals who need this care may find it difficult to access the care. So adequate social support from family, friends, and perhaps the public, and occupational rehabilitation alongside the rehabilitation process can help ameliorate this rather very complex challenge. The fifth challenge I would like to talk about is self-doubt. It is important not to ignore the mental obstacles that may appear on the path to recovery. One of the most common psychological battles that people deal with in recovery is self-doubt. Everyone faces their own challenges during addiction recovery, and many people might doubt their ability to overcome these challenges. Even if they have made some progress during treatment, negative thoughts might start to creep in as they face new obstacles along the way. Throughout the recovery process, patients may find themselves encountering unpleasant memories from their past with substance abuse. This can make them doubt how far they have come and erroneously believe that they haven't made any serious progress or any significant progress. However, it is important for individuals going through recovery to realize that every step in recovery brings you closer to living a substance-free life, which is the ultimate goal. So keeping this in mind throughout recovery can help shed self-doubt and promote a healthier and more positive mindset. I think these are just some of the most challenging encounters people that are having problem with drug addiction may encounter. There are others, that I believe during the course of our interaction with the listeners, we can some can be raised, and we'll be able to discuss them. Now, before I hand over the mic back to Mr. Femi Babafemi, I would want us to take note of certain things, as people who may have these problems in our communities, in our societies. Okay, there are some things we need to keep in mind, so that we'll be able to assist these people. The first I want to talk about is what? A direct heart-to-heart conversation can start the road to recovery. We should also realize that the person with the problem often struggles to see it and acknowledge it. Sometimes this person that is having this problem don't even, like I said, in the pre-contemplation stage, they don't even realize it's a problem. Okay, so they might find it difficult to actually see the problem or acknowledge it. So it takes a lot of effort to make them see that this problem actually exists, and they need to make a behavioral change. Okay, drugs and alcohol can impair the thought processes of individuals with addiction, which makes it difficult for them to follow through on commitment. And that is why it is not uncommon to hear people say, people with addiction, they are not reliable, they lie a lot, they don't keep, to their word. It could be as a result of this impairment in their thought processes, which makes it difficult, for them to follow through on commitment. We should also realize that we should not react with indifference or hostility to people that have this substance use problem, because this can further make it difficult for them to access or accept help. All right. The recovery process, we must note, is a long but worthwhile goal. There is no quick fix when it comes to addiction. There is no quick fix. One must go through the process of rehabilitation. And lastly, I would like to say that your loved one's recovery require ongoing support, time, and effort. So thank you very much for listening. I am back to you, Mr. Femi Babafemi. Let's hear contributions, additions, questions from our listeners. Thank you very much, everyone, for listening.
Thank you very much, dear Dr. Abdullahi Abdulwahab Yakubu, who is our guest today. Thank you for doing a very thorough job to the topic of discussion today. We're glad, and fortunately, you've also made it very brief, even though deep and rich. Okay, let's quickly acknowledge some. I've seen some of old members of the platform already here. I'm very happy to see a newly minted. When I say that, I think I'm the only one that understand, except those that are experts in decoding. That's a newly minted Dr. Asiya Adamubiu. Thank you very much, madam, for joining us. She's a very, very old and senior member of this platform. I'm glad to have you on the conversation today. Thank you, Dr. Asiya Adamubiu. I also have a regular Dr. Kemi Odunloyo, who is, she's hinted me I like to bring. I like to. Where should I say? Okay, am I keeping her secret or not? But then I think she's been. It's no longer even a secret. She's trying to retire from substance abuse campaign. I don't know how she will do that. I know she's somebody who is very passionate about this. Even if she exits today, I'm sure in a few time when she sees the things happening around her, she will find her way back to the effort again. I'm sure she would be making some comments on that when she's making her contribution later on the program. Okay, I've also seen another Kemi, another patriotic Nigerian Kem. That's at Kem Patriot. Thank you, Kem Patriot, for being part of the conversation today. I've also seen a regular member who is joining us on the Niger Diarist. Thank you, and also another regular member, Toles Junior. I've also seen my registered nurse all the way from Washington, D.C., that is Tinuka Idowu at TK. I started you today. I'm sure I shocked you. You won't believe that I could locate you. I located you, TK. Thank you also, Pastor Okezi Atani, for joining. Thank you. Also, LV the God. LV the God has also been regular on the space for some time. Thank you for also joining the conversation today. At Sam, Umar, Mambam, Ben Rula is joining us. Ben Rula is joining us on that handle, but it's actually a doctor of addiction recovery in the UK. Thank you, doctor, for joining us. I've also seen a number of our officers, senior officers of the agency, Bashir Ibrahim, as well as Para Bawa, among others. I'll be acknowledging a number of others as we go forward, but then Dr. Abdullah had already made his presentation, so it's time for us to discuss, interrogate his presentation, and ask him questions. So let's start this way. I'm going to be inviting. Who do I start from? Okay, I think I've seen some interesting questions in our DM. Let me start from our DM first. Dr. Abdullah, please have your pen and paper because I'll be reading the first. I'll be reading the first set of questions in two. Plus, I'll be pairing them so you can respond to them. Sini is writing in and asking, how can a drug user under recovery process rebuild self-esteem and find a new identity? This has been a major challenge. This has been a major challenge drug users encounter even after recovery. Yeah, I think it's a very valid question. Even after recovery, there is still that self-esteem issue. So let's note that Dr. Abdullah again. Inning is asking, what are the most important elements when developing a recovery plan for a drug-dependent person? Dr. Abdullah, please also note this one. What are the most important elements when developing a recovery plan for a drug-dependent person? Let me add this one more before we'll allow you to speak to them. What are the limitations to, still this is also still from Inning, what are the limitations to having group therapy in Nigeria? Okay, it's limiting it to Nigeria. But then, even though this conversation is for the benefit of us in Nigeria, but we're glad we have people joining us from across the world, the US, the United Kingdom, Asia, and all across the world. That's awesome. Okay, so Dr. Abdullah, let's have your response to these first three questions, and thereafter, we have quite a lot of people already on the speakers corner, so would be granting them the microphone. Over to you, Doc, please.
All right. Thank you for the questions. Like the first question says, how can a drug user under recovery rebuild self-esteem even after recovery? Usually, the issue of self-esteem, like the third point I mentioned, usually affected very significantly by the social stigma we attach to substance use. You know, and like I said, uh, once the society, the family, or the people around the person is stigmatizing that person, the person begins to feel less of himself or herself, whether in recovery or after recovery. And in fact, sometimes this stigma makes the recovery very, very difficult. And that is why we say in the person trying to rebuild his or her self-esteem, it doesn't just have to be the person. The society, the family, the people around that person need to contribute their own. They need to make this person feel welcome. They need to make this person feel himself. The person shouldn't feel less of himself or herself simply because he or she had to undergo rehabilitation. Like we say, drug addiction is just like any other illness. Drug addiction is an illness of the brain. You know, just like any other illness, it is treatable, it is preventable, and if left untreated, it can last a lifetime. As the person begins to allow this thing to sink in, that look, uh, suffering from addiction to start with was not because I was a bad person. You know, circumstances led to that. And just like somebody with any illness like diabetes, hypertension, will not feel less of himself simply because he had to go to the hospital to get treatment. Somebody with addiction should not feel less of himself because he had to take the step to get rehabilitation and recover from this illness. So people need to begin to see themselves as individuals who can be sick. You know, any part of your body can be sick, either your stomach, your leg, your hand, in this case, your brain. All right? So it is not unusual for somebody to fall to be sick or somebody to become ill. So it is not unusual for somebody to have problem with drug use. Okay? So after rehabilitation, you need to tell yourself that you need to understand that you have taken the right step to have the rehabilitation done. You have taken the right step to recover. You have taken the right step to become abstinent from what you were doing. You pick your life up and live the way any other person will live. Like I advise people, you don't have to hide yourself. In fact, you should become an ambassador, a champion of or advocate for people who are using drug to have access to care, to come out, you know, and accept care. You know, in that way, you make yourself even more useful to others who are experiencing the problems you experienced. You know, but of course, the society needs to make it a lot easier for them so that they can they can go on with their life without any hindrance. So thank you. I don't know if that has answered your question. Then the second question is about what are the most important elements when developing a recovery plan. Like we say, when you are going to rehabilitate anybody, usually we individualize the plan. That is, you draw each plan bearing in mind that it's an individual. That is one may not work for the other person, and that is why you individualize it. So for you to draw up a plan, a lot of things will influence the elements you put into it. You know, and you will begin to understand a lot of this when you interact with that person and when you interact with the people around that person. All right, what are the priority areas? You know, is this person going to be rehabilitated as an inpatient? Is it going to be done in a facility or at the community level? All right, that you can tell from interacting with the patient. There are those that can be done at the community level. There are those that have to be done in the facility. Okay, is there other areas of the person's life that need rehabilitation, like occupational rehabilitation? Okay, there broken down relationship with the family that you need to do family therapy. Okay, all these things will come if you interact with that person. You will begin to understand the problem areas, and then those will inform your decisions as to what to include in the plan and what not to include in the plan. Thank you very much for that question. Then the last question is, what are the limitations of having group therapy in Nigeria? I think the biggest challenge we have with group therapy in Nigeria is our secretive nature. Usually, we don't believe in sharing our problems with other people. All right. So usually, when you propose a group therapy to people in our environment, they feel reluctant, you know, to discuss their problems in the presence of other people, even if they have similar problems. So you hardly have people who are willing to take up the group therapy when you offer it. Everybody wants his or her problem to be discussed in privacy, just the person and the therapist. You know, sometimes they may allow family members. That is in a very rare situations. So that is the problem. Unlike elsewhere where people are actually free, they feel free to discuss their problem in the presence of other people, our people still have that problem. And that is still not unconnected with this issue of stigma. So that is the biggest limitation we have in terms of using group therapy in our environment. Thank you.
All right, thank you very much, there, Dr. Abdullah. I think let's come back to the platform now. Okay, let me quickly acknowledge a few more people that I've noted or noticed on the platform. Sorry, apologies, I may not be able to mention everybody, but then because you know the number on the space and those who are joining us on other platforms on Facebook and on YouTube. Okay. So I've also seen another senior officer of the agency, Dr. Jonah Kolo. Thank you for being part of our conversation today. I've also seen Zinat Abdusalam, Mr. Litu, AGM for real, Brenda, Peter, David Bodan. I appreciate all of you for being part of our conversation today. But now let's quickly get interventions, our questions from. Okay, I think we should get the first intervention from our brother in the UK, that is a doctor, addiction recovery doctor, who is joining us via the handle of Benrula. Doctor, please can you unmute yourself and let's hear your contribution. Thank you.
Thank you, Baba Femi. Good afternoon, everyone. Am I audible?
Yeah, you are loud and clear. Thank you.
Hello? Can anyone hear me?
We can hear you. You are loud and clear. Please go ahead. Can you hear me?
Yeah, I can hear you now. Can anybody hear me?
Yeah, we are all hearing you loud and clear. Please go ahead.
Oh, all right. I seem to be having a little connectivity issues. I'm in work, actually. So if someone walks in to speak to me, please do not be think I'm being rude. Like you were trying to say that I'm Dr. Zechida and I work with Addiction Services NGO, but we cover mostly public services. Actually, we're contracted to do the public services. Can I just say that Dr. Abdullahi has done a very excellent presentation. Relating to the topic today, challenges around recovery. And he's done an excellent job. He's spoken about the relapses, the mental health, the social stigma, the financial and the self-deflation you get when you're in recovery. More or less what I want to do is, can I have a small contribution? And I'm coming back, I always come back to the basic. Again, if I'm working, I'm doing the same what I'm practicing. The stigma, the self-esteem is one of the biggest problems we have. Because I grew up in Nigeria, I know what it's like. It is hard for people to come out and say, I have drug problem. And then when you go beyond that and moving into recovery, then you're looking at things like the moral thesis surrounding drug use, which is basically how we see drugs. But when you've left that country, what you see is that there are medical components to it. Where I'm working now, what we're doing is to look at substance misuse as a problem where you provide wraparound care. So it's not just a case of you're opioid dependent, you're alcohol dependent. One of the questions we ask is, if you're opioid dependent, why is that different from someone who has high blood pressure? If you look deep down when Dr. Abdullahi is talking about drug problem, there are reasons why people use drugs. We don't know the reasons, but if you work with them, if you do motivational, if you establish that therapeutic relationship, you'll be able to maybe, hopefully, find out why is it existing underlying mental health condition, which in a lot of the cases are overrepresented in drug use. Depression, anxiety, personality disorder, bipolar illness, etc., etc. So a lot of the times people are seeking solutions to problems that are not there. And these are also the things you're looking at when you talk about recovery. Recovery is not just a step. Recovery is a process. Dr. Abdullahi again talked about recovery cycle. So when you look at this cycle, what I do in my practice, like I said before, I'm on front line. What I do in my practice is every step of that cycle, we have a plan. If you do lapse at any stage, we deal with it. We don't blame you. We don't accuse you, but we have a plan. Contingency planning, it helps in recovery. If it's rehab, if it's inpatient, for example, you talked about is the residential or outpatient, it is planned and we support the individual. Let me not take too much of your time. Recovery is something you talk about for a long time. It's something you talk about over and over again. It's something you provide support for repeatedly. It's expensive, but in the end, it pays it back. Is someone speaking?
No, Doc, please go ahead. I'll remove the person from.
All right.
Yeah, Brenda Peter, please remain muted. Otherwise, I'll remove you from the speaker's corner. Please go ahead, Doctor.
Okay. I got distracted there.
Sorry,
anyway,
let me get your name properly. I know this handle. I have some issues with this. Okay, you said Dr. X?
Dr. Echina. Uzo Echina.
Your network is freezing.
It's Dr. Uzo Echina. Is it better now?
Oh, Dr. Uzo. Okay, Dr. Uzo. Okay, let me just note
yeah.
Because of okay, please go ahead.
Yeah, I've forgotten what I was doing. But so the key points, like Dr. Abdullahi has mentioned there, is look at what you're trying to achieve. What we again tend to do is we set up smart, achievable goals. We do them in small chunks. We carry them along. And we do this repeatedly. I know someone asked about how to rebuild self-esteem. One of the things about rebuilding self-esteem is, one, realizing you're not alone, because a lot of the time people think this problem is individuated. You are the only person suffering it. No, a lot of people, even family members, have drug problems. So realizing you're not alone, realizing there's help there, realizing there's a recovery, and it's a process. It's not just one phase. And people have managed to go through those phases, and people have managed through going from rock bottom to becoming a useful citizen again, to becoming employed again, to being able to look after their families. So it is possible. But again, we have to repeat these to ourselves and our patients and our clients. All right, let me stop here. If there's any questions that I can contribute to, I'll be happy to do if you let me, Dr. Femi. And thank you for the excellent contribution, Dr. Abdullahi.
Thank you very much, dear Dr. Uzo, joining us from the United Kingdom. We appreciate your. I'm sure we're already in touch with Dr. Uzo to be a guest on this platform very soon as we wrap that up. will definitely advance.
In a summary, just before I go, we put a human face to addiction and substance use disorder. Does that make sense?
Absolutely.
Yeah.
Absolutely.
Yeah. So that's what we do. All right. Thanks very much.
Thank you very much, there, Dr. Ben, who is an addiction recovery doctor practicing in the UK. He's also another a great ambassador of Nigeria out there. He's a Nigerian, but living and working in the United Kingdom. Thank you once again, Dr. Uzo, for always finding time to be a part of this contribution to humanity. God bless you. Okay, let's take the next one from Mr. Warishop. I know it's also a handle for somebody who is also familiar. He's here. Warishop, please go ahead with your contribution or question. Or would Dr. Abdullah want to say something to what Dr. Uzo just what he just said? Dr. Abdullah?
So let's allow the listeners make their contribution and ask questions. When I'm wrapping up, I will speak to some of these issues. Thank you.
All right, thank you very much, Dr. Abdul. Mr. Warishop.
Please, can you hear me?
Mr. Yes.
You listening, right?
Yes, please go ahead.
I think the case of drugs
no,
disorder.
sorry, James Morris. I have not actually granted James Morris. I don't know how he got. No, James Morris, I have not recognized you. I gave somebody the microphone. So please be muted until we get to you. Okay, let's get from another person, and that's okay. Let's hear from okay, Perpetua. Unfortunately, we didn't allow you, so let me not take that risk this week. Perpetua Nnamdi Emmanuel, let's get your contribution or question today quickly.
Okay, sir. Good evening, sir. Thank you so much for this opportunity. Thank you, sir, for the point that you have given us in recovery in drug addiction, and the key point there is just that it boils down to personal determination and whether you are even is it an easy thing to even come out from. I just have one contribution, and I just want you to answer a question that is just a personal and experience, that if you have really seen someone that have come out from it and without relapse, clean and this person that have come out from drug addiction, it's a mental thing, it's a brain related issue. And when we are talking about drug, it's not even only brain it affects. Brain is a central center of the body. Whatever that happens in our body boils down to the brain. So, and my contribution is throughout the recovery journey, having a strong support system is important. Our family and friends have a role to play in providing emotional support and encouragement. Then my question now is that can you share a personal experience of someone who successfully overcame drug addiction? What were some of the specific recovery challenges they encountered, and how did they overcome them? I believe you
Thank you very much.
My question.
Yeah. Very well, it's noted. I think that I was actually, there is also a similar question like that with me here in our DM. I'm sure Dr. Abdullah, Perpetua, another person again at DM would like you to share a real life experience with everyone on the platform, because people usually believe this real life experience narrative, so that they can always take that, live with that, and compare. Yes, Dr. Abdullah first, then I'll come to Dr. Uzo, who I think has raised up his hand again.
Okay, thank you very much for your question. Regarding real life experience, let me just give one example. When I was in 100 level, I had a senior colleague who was in 300 level. You know, a very brilliant young man. I remember he used to take us tutorials and the rest of that. But he had to drop out because of substance use. And I remember quite all right after he went through rehabilitation. He went back to medical school, and as we speak today, he's a psychiatrist, just like myself. All right, that is just an example of somebody I was close to, somebody who was my senior, somebody who had helped me in the medical school by putting me through some of the courses I was doing that I had trouble, grappling. You understand? And he had this problem of addiction. He went for rehabilitation. You know, after he completed his rehabilitation, he went back to medical school. Though it wasn't the same school, he went back to another school. But eventually, he graduated as a doctor. And today, as we speak, he's a psychiatrist, and he has remained sober since that rehabilitation. You know, a lot of people talk about this issue of relapse. You know, let me tell you that substance use disorder is not the worst when it comes to relapse. Let me just give you some comparison. For example, okay, if you look at the relapse rate for drug use disorder or for addiction, the relapse rate is 40 to 60%. All right, 40 to 60. That is when you have 100 people that go through rehabilitation, the number of them that will likely relapse, about 40 to 60 of them will relapse. All right? Let's look at type 1 diabetes. We have a relapse rate of 30 to 50%. Let's look at hypertension. We have a relapse rate of 50 to 70%. Let's look at have a relapse rate of 50 to 70. So if you look at, but nobody in the society talks about, oh, your hypertension, the relapse rate is too high, or asthma, the relapse rate is too high, even though the relapse rate for hypertension and asthma is much higher than that of drug addiction. All right? Of course, relapse is a big problem, you know, but then it is not the worst when we talk of relapse rates in comparison to other chronic medical conditions. So, of course, quite all right, some people do relapse, but of course, we have also a lot of success stories, people who have gone through the rehabilitation process and they have come out good, and they have reached the peak of their careers. All right, we only need to encourage them, to support them, and tell them some of these positive stories. That look, there were people in this your shoes who have been able to go through the rehabilitation process, and they have done well. And we must also admit that the rehabilitation process is not an easy thing. Quite all right. It is a difficult thing. They must understand that, and we must also understand that. And that is why everybody need to support them to go through that process. But quite all right, there are success stories, very, very beautiful success stories. Thank you.
Thank you very much there, Dr. Abdullahi. That's I also know people that I can also share their recovery story, very successful and very encouraging, and they are part of the advocacy drive today against, they are not even in the medical line, but they are people who have also gone through this, and they are on their feet today, doing well, and in their areas of chosen endeavor. Okay, let's come back to Dr. Uzo. Dr. Uzo wants to contribute something, please. Go ahead.
Thank you, Baba Femi again. Am I audible?
Yes, you are loud and clear.
Okay. Again, Dr. Abdullahi, excellent contribution. I've seen so many good stories. Like I said, I work frontline, so I've seen so many good stories. But I just want to use this one, which is personal to me. When I came back 5 years ago, my in-law called me that one of our children. He was in his final year, biochemistry in Port Harcourt, but he was admitted in hospital for acute presentation. Bizarre. They didn't know what was happening to him. So when I got to the hospital, once I saw him and his behavior and the way he was acting, I knew immediately it was drug-induced psychosis. Just to add to the history, if it makes sense, his father is a chronic cannabis user. He's still using till date. His mom wasn't aware the child was using. So when I saw him, I spoke to the consultant. This was in Ikeja, in private, on how to manage this drug-induced psychosis, which thankfully Dr. Abdullahi would also agree to this, that they respond very well to antipsychotics. So after a week's admission, he was discharged. All those bizarre symptoms, the hallucinations, hearing things, seeing things, they were all gone. And then I called him, and he told me exactly what he was using. Apparently, he wasn't using normal weed. He was using one of those skunks, high potent THC content cannabis. So that was the cause. And then we talked about what was going on. But in a nutshell, what happened in the end, he's not using cannabis now. He went back to school. He finished his exams. He's done so well that he has his own private business. So if that's not recovery, if that's not enough to encourage anybody to undergo that process of recovery with support, by the way, I don't know what is. So it is possible to recover from it. Sometimes it may take longer. It may be longer than a year. It may be longer than 5 years. So for some people, it's a small step, but when you add all the steps together, they become a big achievement. All right, let me leave it at that. Thanks very much again.
All right, thank you very much, Dr. Uzo there. Dr. Uzo is joining and making these awesome contributions from the UK. We appreciate you, and we appreciate our guest today, Dr. Abdullahi Yakubu. Thank you for being part of this conversation, and it's getting interesting. I'll tell you quite a lot of responses in our DM. Okay, let me quickly, before I come to you, AGM for real, please prepare for your comments or questions. But before I come to you, let me read. Okay, I have Dr. Asiya Damubio in our DM. She's saying stigma and labeling affects recovery and self-esteem. Psychosocial support is paramount. Thank you very much there, Dr. Asiya Adamubio. I also have our own Asma Ahmad in our DM saying, with this, it is safe to say the future is mental health and mental health is drugs. Well, okay. Karim Olushego is saying great work. And also from Mr. Warren Shop, that's more like giving guidance and direction from rock bottom to being useful. I'm sure he's reacting to the presentation by Dr. Abdullahi. Also, Danny Varsity also says encouragement and support is paramount to end addiction. Absolutely. Again, Abubakar Mode is saying, I went to rehabilitation process. Definitely, I couldn't find it easier because the most difficult part of it is peer group. Okay, that's he's sharing his own experience there. Mahatan says it's such a great topic today. I feel like a doctor myself. You are not yet a doctor, Mahatan. No, just make use, get this fact, get this information, and let them guide you. Not, but don't see yourself as a doctor. But actually, I understand where you are coming from. Okay, situation 7 Joba. I think this should be to stop this act. Think local area. I think local area need much attention. Officers of laws in some areas only collect money from the marketer, and at the end, let them go and they continue the business or deal. Okay. Rabiu Usman, I actually don't know which particular incident or which law enforcement agency is referring to there, but then that's noted. Okay, Rabi Usman, good. Okay, what about those having seen? Um, okay, let's go back to the platform now. I think I've read enough from that. Um, okay, let's take, okay, AGM for it, please, your contribution quickly.
Okay, good evening, everyone. Mr. Femi, I know you don't remember me. This is Abduganu. I was a regular, before now. A quick question to Mr. Abdullahi. Mr. Abdullahi, I must comment your presentation, even though it is short. I wish it is more robust, more lengthier than that so that we can learn more. You made mention of what's it called? Drug addiction or addiction being a disease. So I was wondering, is it some people can be more vulnerable to addiction by default, as a disease? Or so I just think I felt I would need more clarification on that because I don't know. There is this popular saying, oh, there are some people, maybe if they use drug, they have a light brain, they get easily addicted or something. So I felt it is important you shed more light on those areas. How is it a disease, and what are the signals to know that maybe some people naturally, I don't know, have that disease, just like some of your comparison, like when you're talking about relapses of diabetics, high blood pressure, and all that. So is this addiction also the same way like those diseases? Because I know probably some people don't have those diseases like diabetics, name them, why some people do have them. So is drug addiction also the same like that? I want to know. Thank you, sir.
Very well, thank you, my brother, AGM for it. That's Abdul Ghani. I think I'm trying to connect the dots, the lines now. I definitely remember you. Okay, over to you, Dr. Yakub.
All right. Thank you very much, Mr. Abdul Ghani, for the question. Yes, addiction is a brain disease. It's a brain disease in the sense that, like I mentioned from the beginning of the presentation, anything that will change the structure and the function of any tissue, any organ, or any cell, it becomes a disease. So, like I said, prolonged use of drugs or continued use of drugs leads to change in both the structure, the function, of the brain in a very, very significant and sometimes even permanent ways. All right? So it's a brain disease. Another reason why we say it's a disease is because just like any other disease, it is preventable. We can prevent it, and that is what NDLE and other organizations have been trying to do to prevent the use of the substance, so that you don't even have the problem if you don't use the substance. It is treatable, like we are discussing today, rehabilitation and the rest. And we are also aware that if you do not treat it, it can last a lifetime. That's why we say it's a chronic disease. All right. We are also aware that it can change the biology of the brain, not just the brain, and every other organ in the system. So to answer your question, yes, it's a brain disease. And now the other part of the question, whether some people are more susceptible, yes, of course. There is a genetic component to drug addiction. All right, studies have shown that some people are more prone to having addiction problem compared to others. That is the risk of somebody, for example, who has a first degree relation who is suffering from addiction. That person's risk of having addiction is higher than somebody who doesn't have any first degree relation with addiction. For example, if somebody's parents, or siblings have problem with addiction, all right, the person's chances or risk of suffering from addiction is much higher. All right, so clearly there is a genetic predilection to addiction. Of course, even though specific genes have not been identified, but it is studies have shown that yes, you can have addiction run in families. You can have some people who are very much have higher predilection to addiction, and that is why you can have somebody who will tell you that why are you asking? They bring somebody to the hospital, for example, with a psychotic breakdown following the use of cannabis, for example. All right, and then after this person, get better with the psychotic problem, and you are trying to counsel the person that look, what led you to this place is because of this cannabis you have used, and then the person is telling you that, but my friends, my other friends are using it, and they have not had this problem. All right, and you need to make that person understand that yes, it is possible they have been using it and they have not had this problem because your genetic makeup is different from their genetic makeup. So they may smoke it and get away with it, but it is obvious that you haven't been able to get away with it. All right, so there is of course genetic predisposition. All right, but of course, in a nutshell, the substances are better avoided. All right, thank you.
Thank you very much, Dr. Abdullah. There. The thing is, avoid it. Thank you. Okay, let's come back. Okay, I think I'm seeing Dr. Uzo's hand. He wants to make a contribution to that. Okay, quickly, Dr. Uzo.
Yeah, thank you, Baba Femi. Again, excellent contribution, Abdullahi. Just to add to what Dr. Abdullahi said there, one of the ways I try to explain this to people is the nature and the nurture effect. So he's explained the genetic predispositions, but you also have the environmental component. And one of the things that we do not talk about as Nigerians are, there's a very popular study, Dr. Abdullahi will be familiar with this, adverse childhood experiences. So there are criteria, there are factors which have been identified to increase the predilection, the predisposition for people to develop certain illnesses. Say, for example, if both your parents are alcoholics, if they are alcohol dependent, the likelihood is you're going to develop alcoholism. So there have been studies which establish this. One of the ways this has been done is if you have twins and one of them is raised by parents who is alcoholic, compared to another one who is not raised by alcoholic parents, the likelihood for the one being raised by alcoholic parents is that they will turn up having alcohol dependence. So that's a typical example. Then when you look at things like physical abuse, psychological abuse, child neglect, sexual abuse, domestic violence, mental disorders, these are factors that can predispose someone, increase someone's risk of developing drug use disorder. This will also increase someone's risk of developing mental health disorder, depression, anxiety, all of those. And that gets worse when you have the environmental key turn on, if that makes any sense. But anyway, not to take too much of your time and for other people to contribute, I'll stop here. Hope that helps. Thank you.
Thank you. Thank you. I appreciate that. That's just an addition to what Dr. Abdullah has said. Thank you again. Apart from the genetic disposition, we also have predisposition. That is, Dr. Uzo has also added the environmental factor, which is also another predisposing factor. Thank you again, Dr. Uzo, for the excellent addiction. Okay, let's take the next contribution. I've called you before, Mr. Warishop, your contribution or your question before we go to others.
Yeah, good evening, everybody. Dr. Abdullahi, thank you. Dr. Uzo, thank you. However, what I actually wanted to talk on was when someone, I don't know who was now, when he asked a question about recovery and if they had testimony. Now, what dragged me into this field, like I said the other time, I'm an engineer by training. I remember my 300 level in the university. I actually attended Ambusali University in Ekbuma. There's this chronic cannabis user in my hostel. And this guy is so smart and very intelligent that when he uses it, it becomes a vegetable. And it pains me a lot because he has spare time for me to take me thermodynamics, and I don't do drugs. So I try as much as I can to like, why are you doing this? Why not this and the rest? Just luckily enough, doctor just mentioned it now. His story was from the parents. Now both parents are addicts, and he started using it when he was very little. So just for the sake of maybe I should say selfish reason now that is taking me thermodynamics, and I don't want him to just useless himself. I try as much as I can to like, okay, he's taking it. He have his own timing that he don't miss. 8 a.m. He do 5 p.m. So what I try to do, I'll be like, okay, maybe 5 p.m. I'll be like, okay, come and take me the thermodynamics class. And over time, from my 300 level to 400 level, this guy begin to tint away from drugs and all that without an little talk. Boy, see now after 2 weeks that you've not taken this thing, you are looking fresh like that. And he's clean now. The last time I saw him, I was so proud that I even wanted to invite him for a program in Warri, but he was so busy. Now, what am I saying in the nutshell? This thing is possible. Like the expert have said, is very difficult. I think determination, encouragement, and just letting this person who is depressed, like we all alluded to, or this person who is feeling timid, who is feeling not belonging to this, just making them feel like you are one of them might also help a lot. It not might, it helps a whole lot when someone feel like, oh, you are part of me, you are running this race together with me. That encouragement helps a lot. I want to say thank you to the expert. I really enjoyed the time here, and listening to you guys is encouraging me, and I think it's going to help me do more. Thank you.
Thank you very much, Mr. Warren Shop. That's another brilliant and excellent testimony from him, and that's why we say, whoever we are, wherever we may be in our own little sphere, we have some level of influence, and he has just shown us now that with his closeness to his classmate, his colleague in school, he was able to take him off substance abuse, and that's why we keep talking about this. We all have a sphere of influence. Let's make use of that very positively, especially providing information and guiding those who are struggling with substance abuse. Thank you very much for that brilliant and excellent testimony. God bless you again. Okay. Okay, I've seen Dr. Kemi come back. I think okay, let's quickly take the next one. I'm sure Dr. Kemi will come back to you shortly. But then let's take okay, let me quickly acknowledge James Morris, Deronke Ola, Mr. Princeway, Mike Foley, and now it's time for Mike Foley to ask his question or make his contribution. Mike Foley, please go ahead.
Hello, good evening, guys. I really appreciate you guys' effort, though I joined lately. But I just want to ask a question because I have a brother suffering from this problem back home in Ondo State. I don't know if you guys have any clinic that you could recommend that could take care of him. That's just my question.
All right, thank you very much, Mike Foley. There, please. I started this conversation by talking about call center. Our call center would talk with you. The number to call is 0800 10203040. They will assess the situation, the condition of the person, and then guide you. If it's somebody they need to engage in teletherapy, if it's somebody they need to check into a rehab, they will guide you appropriately. Otherwise, you can also contact If the fellow is based in Ondo State, especially the state capital, we have a command in GRA Akure there. They would also provide support. You can also contact them there. But then, if you need further assistance, please just send a message to our DM. We would be willing to guide you. Thank you very much,
Okay.
Mike
Okay.
Foley there.
Hello, sir. Can you please give me the number again?
Yeah.
The number I just called.
Okay, 0800
0800
yeah,
10
20
20
30
30.
then 40. It's a 12-digit number.
Okay, sir.
0800 10 20 30 40.
Okay, sir. And the another problem is it's not ready for rehabilitation. I believe is normal, but I know it's not.
It's not. Yeah, that's one cardinal thing. The major thing, the most important thing you have to do at the level of the family. He has to be convinced that he has a problem. You need to talk him through. That's what Dr. Abdullah Route to Recovery, direct heart-to-heart conversation. I'm sure. Let Dr. Abdullah, would you want to talk about that? The person has to be willing. He has to submit to treatment. Otherwise, there may not be much. Okay, Dr. Abdullah, please go ahead.
Yes, sir. Yeah, because actually we don't encourage rehabilitation that the person have not consented to. You know, when you do that, you usually do not get the results you want. So, but in the process of rehabilitation, we can start with motivational interviewing. The essence is to motivate the person, is to lay bare the problems for the person to come to realize that yes, indeed there is a problem. And that is the essence of that motivational interviewing, to get the person motivated enough to want to have the rehabilitation. So that needs to happen. Whether you do that at the family level or you can do that with a professional, a professional clinical psychologist who can take the person through that motivational interviewing to motivate the person to understand that there is need for rehabilitation. Like I said, most at times these people do not even see the problem, or they do not even acknowledge that the problem exists. It is people around them that are able to see that there is a problem. But with that motivational interviewing, they'll be able to help the person to understand that, look, there is a problem and you need to make a behavioral change. So I think that will help. Thank you.
All right, thank you very much there, Dr. Abdullah. Let's quickly move to, I think also we have someone who has also seen it. I won't, let me try and be careful so I won't say he has seen it all, but it's someone that has passed through the challenge and today is also leading a very massive advocacy group, especially across northern states, and that's Ibrahim Yusuf is leading the drug-free Arewa movement, and so he's joining us on the handle of drug-free Arewa movement. Okay, please, Ibrahim, let's hear from you. Ibrahim, can you hear me? Okay, if Ibrahim is not okay, the Niger Diary, please let's take the next contribution or question from you quickly. Please go ahead and unmute yourself. Okay, if the Niger Diary.
Thank you.
Okay.
Good evening, everyone. Good evening, Doctor. Thank you very much for a beautiful presentation. I don't know if it's a question or intervention, however, what I'm concerned about is we all know that treatment is very expensive. I mean, a difficult process at the same time. So I'm just concerned. I mean, at the community level, I mean, I stay in the north. I know how it is at the community level. I mean, so how is there a way? I mean, how do we localize treatment for the common users to access? Thank you very much.
All right, thank you very much, the diarist. Okay, let's hear from Mr. Prince Will again. Mr. Prince Will, quickly, please.
All right. Thank you very much, sir. It's an opportunity for me to be among the speech. For quite some time now, I've been following up, but today was a lucky day actually for me to be granted this the mic. Actually, I want to ask this question, and in time of question, it's also like a contribution. They always talk about recovery problem challenges, how to recover. So is there any way, like, let's look at the herbal way? Is it any form of herbal means of recovery? Because why I'm saying this is because I know some, but actually, where I stay, it's a place that they did. Well, I mean, when it comes to drug, I grew up there, but that's why I had the passion to also join to fight the cause. Because as a grown up child, I see people dealing on drugs, dealing on hard drugs. So every now and then it's annoying on my own side. So I have the passion to also join the fight. Though this just I didn't make it, but I don't know. But I saw somebody that came out of this old drug of a thing. He started taking this what's it called? Recommended scent leaf. They wash the leaf and what's it called? This drinking it that it's erases the body or the heart. I don't know. He was saying that was like I don't really have much of idea about that, but I know that I'll definitely one day still ask this question. That is why I that's my question, sir. Actually, thank you.
All right, thank you very much, Mr. Prince with that. Okay, Dr. Abdullah, would you want to say something to that?
Um, okay, thank you very much for your question. Uh, I'm not aware of any, traditional treatment available for drug addiction. All right, and in drug rehabilitation, what people need to understand is what we don't use much of drugs in the rehabilitation setting. Mostly, it is just psychological interventions we do. We use drugs where there are troublesome withdrawal symptoms, where you have to intervene to relieve some of the symptoms, or when you want to do very quick detoxification, you give antagonists of that particular substance the person is taking. But mostly, it is basically a psychological intervention. So really, I'm not aware of a traditional means of treating drug addiction. So I can't say much about that.
Thank you very much.
I want
Okay, go ahead.
the is it the diaries or something like the person that spoke before this speaker? He mentioned how expensive rehabilitation is and how that can be made available and accessible to people at the community level. Of course, I wanted to speak to that. It is actually a concern, and a lot of these things I think should be done at the policy level. Because if you look at it, of course, large chunk or large majority of the people who actually need this rehabilitation are in those communities who do not have access to rehabilitation services. I say it is a policy decision in the sense that what we are advocating for is for mental health to be incorporated into the primary healthcare system. All right, such that an individual is able to go into any primary healthcare center and access mental health services. So if that is done, I think a lot of the costs we are talking about will be reduced. It is expensive because the services are not readily available. If you look at the mental health services available in the country, they are majorly mostly situated in the tertiary health centers, which is not supposed to be so. We're supposed to have these services at the primary level, the secondary level, that the general hospital, and even at the tertiary health center. So until we are able to do this, bring it down to the primary healthcare level, there's going to be this challenge of accessibility. So that is just it. So I hope our leaders eventually will realize the importance of bringing mental health services down to the grassroots so that a lot of people can benefit. But like we say, be it as it may, finding ourselves in a situation that we are where demand outweigh the supply in terms of the services. That is why we are placing more emphasis on what prevention. It is the cheapest and the easiest thing to do, or the best thing to do, is prevention, is to take this fight or to take this enlightenment to the community level, let them understand that, look, it is better not to have this problem than to have it and begin to look for solutions, because sometimes the solutions you may not be able to afford it. Thank you very much.
Thank you very much, Dev. That's another brilliant contribution from Dr. Abdullah. Thank you. Okay, let's, before I come to Dr. Uzo, let's quickly take the question from, okay, I think there's a contribution from, that's Abubakar Mood. I think he has an experience to share. Abubakar Mood, please quickly unmute yourself and let's hear from you in a few seconds before I get, we get the contribution from Dr. Uzo. Yeah, Abubakar Modi, are you ready, or I move on? Okay, he's not ready yet. Okay, Dr. Uzo, please go ahead.
Thank you again. Just to add to what Dr. Abdullahi has said about the question regarding herbal treatment, again, on my end, I'm not aware of any herbal treatment. However, there are drugs that are plant-based, some like CAT, MCAT. It originated in Northeast Africa. People chew it, but these are stimulants. A lot of them are stimulants. That's one. One of the things that people do, again, is sometimes people think manufacturing drugs, you need a large place. No. A lot of the times what they do, you have just a microwave, but they get the ingredients from China. So a lot of the leaves they claim are herbal are sprayed. They are impregnated with drugs, which they mixed up in their kitchen. You'll be amazed what people do. So these leaves that they tell you, oh, that's the herbal treatment, are more or less substituting their original drugs. That's not rehab. That's not treatment. What Dr. Abdullahi has explained there is what we do. We treat the withdrawals, we do the rehab, we can use blockers for the drugs. As far as herbal treatment I do not know of any.
All right, thank you very much, there, Dr. Uzo. Okay. Are you done? Okay, thank you.
Please, I wish to have a conversation in this.
Please, the rule here is until we give you the mic, you are not allowed to interrupt, and that's not too good for you. Okay, I think at this point, let's hear from Dr. Kemi Olunloyo. She's been in and out. Like I said, I'm already preempting. Even she has preempted herself because she has shared some videos announcing her contributions, what she's done in the last couple of months, 15 months, and so she's tired. She wants to retire from drug advocacy. So, but I'm sure she will soon be back. Yeah, Dr. Uzo, no need to shed tears because I know she'll be back. I know she'll be back. Okay, please go ahead, Dr. Kemi. Let's hear from you.
I have some good news on that note. First of all, I want to thank everybody. It's actually 18 months, not 15, but it's been a long time. You cannot totally retire from anything. I started journalism on February 9th, 1994, and that's 6 months' time, it'll be 30 years. And many of my colleagues retired at that 30 junction. Shout out to Bola Musuro, by the way, BBC. Bola is also retired. So in 30 years, February, I'm going to be out of journalism totally. I'm going to other things. And that other thing I've already started, and there's some good news on there. Wellness for African women. Africa is changing daily, Mr. Babafemi and everybody listening. Africa is really changing. Look at the United States. Look at what's going on with the Generation Z. We started with drugs. We started with gun violence. Then we went to drugs. Now we have just straight up looting, theft, and armed robberies. Broad daylight. Mr. Lai Mohammed said this when he was Commissioner for Tourism, and they warned Nigerians going to the U.S. of armed robberies, and now it's happening, and it's been happening then. We're not seeing more videos. So there's a lot to work on. What I'm doing now is wellness for African women, and it is only on one portal. It's on Facebook, and it's called Chemified Africa. So I want the whole of Africa to be chemified, especially African women. But the good news part of it, Mr. Babafemi, it's a humongous fundraiser that I'm doing. Now, it's a little different because GoFundMe was the one that actually gave me the idea. They said I can actually do my drug abuse advocacy on their platform as well as raise money for what I need. So if you go to that link, you'll see it. If you click my tips on Twitter, you'll see it. If you go to my Instagram, it's on the bio. It's just, GoFundMe.com/Kemi Talks Drug Abuse Gun Violence. That one word, Kemi Talks Drug Abuse Gun Violence. You'll see all my drug abuse posts there. There's 44 posts I did in the last 48 hours, 44 posts. And then when you're leaving, you learn something, and you might want to leave with donation. So what I'm doing is I'm arriving in Togo tomorrow. And we're starting in Togo, a university, I can't say their name yet, a university in Cotonou, Republic of Benin, wants to honor me for Drug Abuse Africa. Now, you guys know I did Drug Abuse NG, Nigeria. I did End Drug Abuse Niger and Drug Abuse Africa. That university is a big university. They said they want to honor me for my work in Drug Abuse Africa. I'm going to be there. I'm going to be in Togo. They've already invited me, the president's people at Ivory Coast, Cote d'Ivoire. I'm going there. I speak French very well. Ghana, I'm going to stop by again. And we're moving all the way to Sierra Leone. And also I'm going to see the first lady in Sierra Leone. So Chemified Africa, facebook.com/Chemified Africa for posts, news, views, wellness, drug abuse. What I'm doing is I'm teaching African mothers about drug abuse. We have to start somewhere. If I can teach every West African mother about drug abuse, they will know the products. They will know the dangerous things to teach their own children. So that's the whole idea. Now, remember, Chemified is a wellness space. So we have health, wellness, cooking. I have a lot of stuff there on Facebook. But the drug abuse is infused in there as part of the wellness. If your mother is well, you probably won't be doing drugs. If you're well, if your mother educates you about drugs, you probably won't be doing that. We need her to be well to educate you. So I felt that what President Buhari did in 2021 with the WADA program to make sure teachers are teaching kids about drug abuse in schools, you cannot take that WADA program and take it into the community. I've always said every community, every workplace, and every school. So I'm going into West African communities to teach moms how to teach their children against drug abuse. So that's what I'm doing now. So we're on GoFundMe, we're on facebook.com/Chemified Africa. I want to thank the NDLEA. Mr. Babafemi, thank you so much, you and the chairman, for that beautiful letter that you wrote. Thank you so much for the school program. The videos on YouTube, everything I did. And finally, I want to tell everybody, for all of you that come to my DM, that you have a problem with drugs. The NDLEA helpline is there, 0800-1020-3040. They will help you. Don't be stigmatized. What doctor just said, stigmatization. Don't say, oh, because I'm going to NDLEA's treatment, then everybody will know. No. It's all confidential and it works. Okay? And please, let's all get together on this joking about drugs. Don't call someone a drug addict. I get it all the time. You don't like what I wrote in my journalism. No, she's a drug addict. Stop it. This demon is so bad. Drug abuse is a demon. So stop doing drug jokes. Stop shouting Uncle. So finally, I urge every journalist in Nigeria, and it's a shame, these spaces should have had journalists every single week. They only came when Shore was talking about weed, legalizing weed. You must be here every week. I am encouraging every journalist, every pharmacist that I met in Nigeria. Pharmacists said they're scared to get involved. How can you be scared? You're giving medications and your medications are walking out of the pharmacy. Look what happened in America with fentanyl. A drug we were dispensing for pain in the 90s is now everywhere, killing people. Pharmacists, media practitioners, start talking about drug abuse. And that's about it. Mr. Babafemi and everybody that joined me, This will be my last day for a long time because Fridays are no longer available. I'm going to be in West Africa throughout this fall. Fall in America is called September, the Ember months, September, October, and throughout the fall. And then in January, I'm going back to the States. And we have to continue. Like I said, every community, every school, every workplace. It's not activism. It's not a movement. It is advocacy. Every one of us is an ambassador to the NDLEA. Thank you, sir.
Thank you very much, Dr. Kemi Lawyer. I appreciate your contributions always. Okay, quickly, because you won't believe we have enjoyed this conversation so much, so well that just 2 hours is gone, just like that, and we have barely 8 minutes left on the show. So I'll like to quickly give pass the mic to one of our officers. I have a psychosocial counselor, Adamu Ibrahim. But before I come to him, let me pass the mic to. Okay, I've seen Kem. Okay, Kem, please go ahead. I've seen
Thank you
your
very
hand now.
much. Thank you very much. I'll make it short and sharp. Good evening to everyone. Good evening, my namesake. Fantastic job you're doing, and may God continue to strengthen you. Dr. Babafemi, well done. Mahmoudi and everybody on stage, well done. I just wanted to say here that one of the greatest take homes from this particular space, and many thanks to our speaker, is the fact that people on drugs, should not be labeled addicts. They should be looked at as people who need help, and we should come off our high horses and try to help them. We should also remember that it's not something that will go away in a day. It's something that might take a while, and so we should have some sympathetic understanding, right? The real enemies are the barons, the mules, the people trying to make money from these very evil acts, right? They are the enemies. But the people who have mistakenly fallen into the ditch of using drugs should not be labeled. They should be seen as people who need help. I just wanted to say that. Thank you very much, Mr. Bafemi, for the opportunity, and thank you to everyone who's listening. May God help us. May God save our young people from drugs. Thank you.
Thank you very much, Kem. I appreciate you, and please do take the weekend to take some hot tea. I know you won't, but I know what I'm saying, and you understand. You understand that. Thank you. I know she's someone I appreciate a lot because I don't know how she copes, but then I have seen some signs that indeed, but be firewood. Thank you once again, Kem. God bless you. God bless what you are doing. Okay. Okay. I want to come to Dr. Kolo. Dr. Kolo is a senior officer of the agency. Let's quickly get from him before we draw to the end of the. Okay, then let Dr. Abdullah prepare for his final remarks, and then maybe we can also take some final shot from Dr. Uzo before we close the space. Quickly, Dr. Kolo, in 30 seconds. Oh, Dr. Kolo, I lost him there. I think his network dished him there. Sorry about that. Okay, there was someone that was trying to. Okay, I think at this point, let's Dr. Uzo, let's see if you have some final remarks before we invite Dr. Abdullah to make his last contribution before we close the space. It's 2 hours already. Please go ahead, Dr. Uzo.
All right, thanks again, everyone, and good luck to all your future endeavor, Dr. Olukemi. It's wonderful seeing people progressing from where they are. Dr. Femi, what you people have been doing NDLEA, it is very good. It's commendable. I think we should encourage, like Kemi said there, our journalists, we need to spread the news, the awareness, the education. That's the key to drugs management. The policing aspect of it, you people know how to, but they all have to come together. Drug use, drug misuse, and drug management do not happen in isolation. We have to provide some sort of wraparound mechanisms where we're able to support our young ones. It's costly for people to end up in drugs. It's cheaper to get people out of drugs at any point you look at it. And that will be my final remark. Again, very excellent presentation by Dr. Abdullahi. Thank you.
Thank you very much, dear Dr. Uzo. Let me let the cat out of the bag. This time next week, we would actually be discussing the issue of stigma, then the role of parents, family, friends in getting help for mental health and addiction patients. Please, let's look forward to that. We'll be having a lady in that field on the space next Friday who will be talking to us on this, and definitely it's going to be as interesting as we've had today. Okay, at this point, I'd like to invite Dr. Abdullah to make his closing remarks. Thank you, Dr. Abdullah. Over to you.
Once again, Mr. Femi Babafemi, and thank you very much to all our listeners. Before I give you my final take, I want to make an appeal. And the appeal is that, as you can see, a lot of people who have this problem, who really need this to hear what we are discussing here, are not on this space. It is our responsibility, those of us that are here, to take it to our communities where these people are. Let us be advocates in bringing an end to this very serious problem on our streets, in our areas, in our places of worship. These people are there. Let's take the message to them. Majority of them, it is the large chunk of them who really need to hear this message. They are not on this space. So we should act as the vehicle to take these messages to them. Thank you. Then my final take will be that let us take note of certain things, that although there are numerous obstacles that may impede progress and recovery, it doesn't mean they can't be overcome with the right strategies. And if you or someone close to you is struggling with substance abuse, know that help isn't out of reach. Like I think on several occasions, Mr. Femi Babafemi have reeled out the number that you can call if there is need. If you need help regarding your drug use problem, you can always call that number. Deciding to seek help is no easy choice, but it is the first and most important step on the road to recovery. And being there for the person in your life who is struggling can make all the differences as they can forge their way towards a happy, healthy, and substance-free life. Thank you very much once again.
Thank you very much, dear Dr. Abdullah. Dr. Abdullah is of the Ahmadu Bello University, Zaria, as a lecturer, and is also a medical doctor, psychiatric doctor at the Ahmadu Bello University Teaching Hospital. He's a psychiatric resident there, and in his private time, he also works as supports humanity as executive chairman Excel Mental Health Foundation. This he has been doing since 2020. That's a lot of time, a lot of work, because it's not really easy. Just like you've seen, Dr. Kemi is trying to. Well, she has decided to change gear, but then I know that if I know her very well, I know you will see her with driving this advocacy anywhere she goes. Thank you very much once again. We appreciate all of us, all the senior members of the platform, and all our regulars, including those joining us for the first time. We appreciate once again our guest today, Dr. Abdullah Abdul Wahab Yakubu. Thank you very much. And another, excellent, brilliant Nigerian out there in the UK, that is Dr. Uzo, who has joined us on the handle of Berula. He's also really shared the space with Dr. Abdullah today. Excellent contribution. Like I said before, he's a doctor he's a doctor of addiction recovery, and he's been doing excellently well. We're already in touch with him. Very soon as we finalize arrangements, he will be our guest on this space. He has already even done more than a guest. Thank you once again, Dr. Uzo, joining us from the UK. Thank you all. Our own newly minted Dr. Azia Damubil, Dr. Kemi Lawyer, once again, I appreciate you. I'll be getting back to you shortly. Thank you again, Ken Kem at Kem Patriot. Thank you for all you do. the Niger Diarist, Charles Jr., my own Tinuke Idowu, that's TK, my own Atinuke. Thank you for joining us from. I don't know whether you are in Colombia or you are in DC today, but I know you are in between DC and Maryland. Thank you for being part of our conversation today. Thank you, Pastor Okezi Atani. Thank you, Love the God, Sam Omar, Mambam. Okay, that's our own Bashir Ibrahim. Thank you, Parabawa, commander there. Thank you, Dr. Jonah Kolo, Zenat Abdusalam, Mr. Litu, AGM for real, that's Abdul Ganil. Thank you, Benda Peters, David Bodan. Thank you, James Morris, Deronke Ola, Mr. Princeway, Mike Foley, and the rest of us, Asma, my own Asma Ahmad, Yusuf Ibrahim, quite a lot. I appreciate all of you. And let me also appreciate members of my team here. Thank you very much, Shidi. Thank you, Musa. Thank you, Francis. Thank you, Mahmoud. Mahmoud is out there in another location. Thank you, Dele, Val, Philemon, Kumbi, Unkup, Charity, John, Ali, all of you guys, Iman, and I cannot mention all of you, all the names, but you know yourself. Thank you for what you are doing behind the scene. I appreciate all of you. And by the grace of God, I've said it, that next week we'll be looking at stigma, role of parents, family, and friends in getting help for mental health and addiction patients. We'll have somebody who is well rooted in this particular field, and we'll be bringing her to this space next week. Until then, I'd like to yield the mic now to Mahmoud to close the space. But don't forget, please, let's be safe out there. It's weekend. Let's not do what would lead us into any trouble. Let's not go into substance abuse. Let's not look for something that would regret for years to come. Thank you once again. My name is Femi Babafemi. I remain your host, and I'll be back with you again next Friday by the grace of God. Do have a lovely weekend. Bye-bye.
Thank you very much, sir. And as you rightly said, this brings us to the end of the program. For more information about the agency, our listeners can visit our website, www.ndlea.gov.ng, and perhaps our social media platforms at ndlea_Nigeria on Twitter, Instagram, and YouTube. And on Facebook, it is at ndlea01. Do join us same time next week for another edition of this wonderful program. Until then, I remain Mahmoud Isa, and over to you, Bamidele.
However, because, and no matter, whatever, because don't do, it is sweet to you, but judgely, it is damage your body, silent killer, honey, know the look face, give yourself a break, even what you don't do, if you die today, I miss you, don't do, no matter, whatever, because don't do drugs.
Thank you, sir.